What's up, guys? Jay back here with Eastern Shore Talk Around Town, and I'm with my podcast co-host Cathy, and we are at Healing Grounds Coffee down in St. Michael's, and we're doing rapid fire. So, Cathy, what does the term self-care mean to you?
Self-care to me means everything. It is taking good care of yourself, because if you don't take care of yourself, you're not going to be able to take care of other people.
And what's one thing that you do for self-care?
Hot tea in any kind of mug that I feel like for the day. So that's why it's perfect that we're here at Healing Grounds Coffee and tea. But that is something I do for myself. And massage.
And last question, what's something you've been watching lately that you've enjoyed or something you're looking forward to watching?
So I'm really a big Outer Banks fan, and I know it's out already on Netflix, season 4, but I have not started it yet because it's a family thing. We do it together. So I'm really excited to start watching Outer Banks again.
Awesome. Thanks for joining us, and catch us next time on Eastern Shore Talk Around Town. Take care, guys. Hello again, everyone. Welcome back to Eastern Shore Talk, your podcast for all things self-care and movies. If this is your first time joining us, we're glad to have you. We are on episode 48. I'm Jay Watson.
And I'm Cathy Castle.
And Cathy and I are very happy to be joined this evening by Dr. Kendra Jones. And Kendra is going to talk about acupuncture and cupping and some other things that she does. Cathy and I know little to nothing about that, so we're going to get a little education, and it'll be fun to dive into a self-care arena that has been different from what we talked about before. So, Kendra, why don't you introduce yourself and tell everybody what you're all about?
Yeah, my name's Dr. Kendra Jones. I am here at the Village in Easton, and I do acupuncture. So let's see. Should I talk about how I got started in acupuncture?
Yep, tell your story about how you kind of ended up going the acupuncture route.
Yeah, perfect. So I had my first daughter when I was very young, just 16 years old. And so kind of got thrown into the medical system from there. There were doctor appointments and I had to kind of answer my own questions. And then I had a baby who I had to take to the pediatrician and answer questions, and really just the medical system, just getting used to it, learning about it, how it worked, paperwork, insurance, all of those things. And it was quite overwhelming. I found myself having a lot of anxiety about those things, like, a lot of like calling and making appointments, and, you need this paperwork and this and that. And it was just a lot. It felt like a lot. So I noticed myself kind of going down the more holistic routes. I would try to Google something, and, we would try like garlic before we would go to the doctors, just all those silly little things that seem so trivial. But yeah, they kind of became an important part of my mothering at such a young age, for not only myself, but for my new baby that I had just brought into the world. And just really the holistic route of things. I was really called to those things, I guess you could say. Kind of heard about acupuncture, couldn't afford it, but I was really interested in it at the time. My insurance didn't pay for it, and it kind of felt like one of those, like higher end services, like a massage, or I didn't know what it was, but I thought it sounded interesting. And I met a doctor that did acupuncture. And so I kind of, again, just went down that rabbit hole of going to college and not sure what I wanted to do. I decided I would pursue acupuncture. And so I ended up in acupuncture school after I did my undergrad. And 5 years later, I graduated, and I knew all of the holistic acupuncture, cupping, everything that I needed to know. And it was an interesting journey. But yeah, I think it really stemmed from wanting to kind of be able to make my own choices, really the holistic feeling of things, and wanting to have a say in my own medical treatments. Maybe stemmed from a little bit of anxiety even.
Kendra, can I ask you a question?
Yeah.
I'm just curious, like, was your background, and I know you're not from the Eastern Shore of Maryland. We discussed that before we got on, but I was just curious if you were brought up that way, if your family were trying to look for alternative methods for wellness, or if that's just something that came to you. And obviously I commend you on being a young mom and doing all that. my mother had me when she was 15,
Wow.
which
Mine at 16, so yeah.
then I didn't have my first child till I was 30. I like stretched that out because of that. I'm like, oh, I saw, a lot of the struggles she had as a young mom, and I'm like, whew, let me just wait on that. So I really respect you being able to be a mom at such a young age.
Yeah, to answer your first question, my mom is a nurse. She's like very much involved in the medical field and not the holistic side. And
Okay.
I didn't grow up with any sort of like no holistic background. I think it almost stemmed from a place of like just wanting to have my own choices and wanting to,
Mhm.
make decisions for myself. The more I was told what to do, the more I wanted to kind of learn for myself what the best thing really was.
Mhm.
I didn't always like being told what to do, especially at a young age. So
Yeah.
So
yeah,
Kendra, when you introduced yourself, you talked about the village. So real quick, before we get into acupuncture,
Hmm.
tell folks what the village is.
yeah. So I'm here at the Village. We are a maternal holistic wellness center. We serve everybody, anybody who comes through the doors, we're welcome to serve, but we really have a focus on mothers, babies, children. We kind of feel like they're an underserved population. A lot of times, you have a doctor's appointment, you can't bring your kid. So we try to make it a place where you can bring your kid if you need to. We have play groups, places for moms to go to support groups. We do pregnancy support groups, postpartum groups. Just lots of different things all focused on motherhood, parenting. We have dads groups. Yeah, so just a lovely place. We have different services here, lactation. We have some counselors, some massage therapists. There's the acupuncturist, me. Yeah, so lots of different things focused on that holistic side and then mothering and parenting.
Well, as you and I discussed before we came on, we're both mothers of four. You're heavier on the girl side. I'm heavier on the boy side. But, I that's great to know that service. I didn't even know that service existed in my own town. So that's
Yeah,
great to know of another resource. But, motherhood is an interesting place, especially when you've got multiples like we do. It's like, I don't know. You have it in your mind of what you think it's going to be, and oh, it's so not.
it is not.
I can,
That's for sure.
I can
Any
remember,
ideas that you had
right?
going into motherhood, it's like that's
No,
not going to work.
I can remember one time being in the Annapolis Mall and didn't have kids yet, and I was like, that is not going to be me. Watching this full blown temper tantrum.
Someone screaming on the floor. Yeah.
It's not going to be me until it was me, and then I was like, oh my gosh, I'm that woman in the Annapolis Mall. But there's no handbook, and you think that it's just gonna come to you naturally. And man, there's some lonely times as a
Yeah.
mother for sure. So glad that I'm glad that's there for people, because
Yeah.
it is a one of the best things you can ever do in your life, but
Yeah.
it is one of the hardest things you can
And just
without a
having
manual.
other people to support you, other mothers supporting mothers, and people that really get it. I mean, if you need to bring your kid in, I understand.
Yeah.
I totally get it. So
And you're only a master of the age you're a master of. As soon as you think you figured it out, now here comes,
you
oh,
haven't.
the terrible twos really aren't is a big fat lie. It's the
Yeah.
threes. It's the threes that are more challenging than the twos, but nobody tells you that.
We just got into the teenage years, and that has been
That's
like,
a whole nother segment. I don't
I'm like, no one warned me about
And
any
a,
of
and a daughter, and a daughter in teenage years.
listen.
Yeah,
Teenage
that.
years bite. It bites. It will bite you. We can have another session about that later.
Definitely, that's going to be needed. I might need a little
if you
therapy session
if you
for that.
survive those years, you got it. And you can.
Yeah,
But
that's
whoo,
rough.
it challenges you.
Yeah.
And
So,
it doesn't matter what your education is, because they will find out.
They
I'm like,
find something.
I've never felt so stupid in my entire life. There's people that think I'm that dumb. But yeah,
Exactly.
your kids will
And
tell you.
teenagers know everything. They
Oh,
they already know everything. So
they,
there's nothing,
yeah,
we should be learning from them
and they
really.
have their own language, like a complete, a complete new language. Yeah.
it's some kind of something. Anyway,
Uh,
So Kendra, we want you to do a little Acupuncture 101, but very, very, very basic class.
Yeah.
Like Kathy and I are coming into your office and we know zero about acupuncture.
Yeah.
Tell us what
Well,
exactly it is, what does it do, what are the benefits. Talk to us as if we were patients and we knew nothing about acupuncture.
so and let's say this. Jay and I don't know for like the rest of the population. We like to think we are, but Jay and I are fans of massage therapy. Jay and I
Okay.
are regulars. We have our people we go to, and we go and we're like zippity doo dah. We feel better, and I'm aware of acupuncture. So are you, Jay? But I still have that. I don't know about those little needle things. So
Yeah.
get us past the ignorance of I'm afraid of needles. Get us past that and really talk to us about
Yeah.
about how to get into acupuncture, how to
Right.
be open-minded to it, I guess.
Yeah, totally. So acupuncture really works with your nervous system. So first of all, acupuncture can treat any kind of pain. We can treat lots of different mental health issues, anything from bad dreams and nightmares to severe
Mm,
anxiety. And I'm not saying it's going to totally go away, right? You're not going to go get acupuncture and
sure.
you've had severe anxiety your entire life and then, you walk out and you don't have anxiety anymore. That's not how it works. It's really going to just tone down your nervous system, relax you, make you feel a little better, allow you to kind of cope with what's going on a little bit better, and just really work on those root cause things. So, we're going to take these tiny needles. So, I'll show you one.
Here it comes.
And
The anxiety.
they're
But
tiny.
let's pause because I like what you said already.
Uh huh.
When Jay and I are talking about wellness activities, we're talking about the nervous system a lot,
Yeah.
and that we are trying to help people learn how to self-regulate
Yeah.
so they do feel better and have less illness. So you're already selling me. You're already selling me.
All right, so I got these tiny, tiny, tiny needles. They're about as thin as a strand of hair. So if you see my hair, it almost blends right in. So they're very tiny. It's not like you go to the doctor's office and you're getting a vaccine or a shot or any of those scary big needles that have something coming out of them. Blood drawn, people pass out. They don't like that. It's totally not that. So we have these tiny needles. When they're inserted in the skin, they do not hurt. You might feel a little sensation, a little tingling, maybe a little prick for a second, but there's no pain. If you are feeling pain, it usually means we need to adjust the needle a little bit, and we'll do that. And usually it resolves right away. Well, if not, we'll just take the needle out, and yeah.
So I'm not gonna lie.
Very painful.
I'm looking at that needle.
Mhm.
I'm looking at it.
Here it is.
So to me, it's still looking a little interesting to me. Like, does
Yeah.
that whole thing go in?
No. Okay, so this is the handle up here. The top is the handle, so it's just a little tiny part of the end needle that goes in. It's just like a small prick. Like I said, it does not hurt. It's not painful. People, they'll come in and it'll be their first time, and I'll say, okay, let's take a deep breath. We're gonna put the first one in, and we'll take it real slow. I'll kind of talk them through it, and then I put it in, and they're like, "Are you gonna put it in?" And I'm like, it's already in, you did it. And they're like, oh, I didn't feel anything at all. So I would say 99% of the patients, when you put the needle in, they don't feel anything. The 1% that feel something, it's not painful. Pain is not like a word they would use to describe it. So it's really gentle. It's actually really relaxing. Yeah. So those are the needles.
So how many of those needles? How many of those are going in?
Yeah. So it just
As
depends.
Like,
you can tell, Kathy's a little apprehensive about the word and
hi.
needle.
Yeah. So
I'm
that's
being
funny
open.
that you say that. So usually when we are talking to a patient face to face, especially if it's a new patient, we know that people are afraid of needles, right? Like it's no surprise that the general population isn't
Yeah.
interested in getting needles poked in them. So we'll use the word acupuncture instead. So I'll say, we're going to have you lay down and then we're going to do the acupuncture. And usually, by the time we've talked and chatted about their life and their lifestyle, we kind of go over a little bit of everything, anything from sleep to diet
Mm.
to where their pain is or what their symptoms are, how their sleep is, just a little bit of everything. By the time we've talked, they become comfortable. We get them on the table. We do the acupuncture. It's really a relaxing experience, and people they love it. Like almost everyone wants to come back for more. So
Well, go ahead, Jay. I know you got some questions. Like, I want to know what a session's like.
yeah,
Yeah, go ahead, start there because I do, but go ahead, because that's one of my questions as well.
I do
yeah,
want to know, like, okay, I'm there, and I'm like, am I going to get 45 punctures, or am
yeah.
I going to get? Is it just like on my arm? Like, what's the deal? How
Yeah.
long is it? I want to know the whole gossip.
So we'll mostly do arms, legs, feet,
Mhm.
hands. We'll do those places people are often more comfortable with, especially the first few times, just to get people really comfortable with what's going on. A big part of our medicine is making sure people are comfortable. You've got to be relaxed. You're not going to get better if you're terrified to go to the doctor and you're afraid and it's painful and you don't like it. That's not going to help you get better. It's not good for your nervous system. You're going to be in that fight or flight mode. It's not good for anyone. It's not going to heal your pain. You're not going to have less anxiety. You're not going to sleep better at night. You're going to just be worried constantly. So we want to make it a really good experience. So usually you'll come in, you'll sit down. We have like a recliner chair. You'll sit in the recliner. I'll sit in the stool. We'll just chat face to face, maybe 20, 30 minutes. Talk about everything that's going on in your life. You ask me any questions, I ask you questions, that sort of thing. And then we'll get you up on the table. Once you're on the table, we do use needles. So we'll put some needles in you, um, anywhere from 2 needles to 10, I would say.
Mm.
Yeah. So it just really depends. Like I said, if I know they're really apprehensive and they're not comfortable, we'll start really small, maybe 1 or 2 needles. Usually by the time you get the first 2 in, they're like, oh, this is fine. You can keep going. But we try not to freak anybody out. So we'll do that. And then we have a nice red light. We'll relax once they're calm and relaxed and the needles feel good, we'll turn on the red light, do some like red light therapy. They'll lay
Mm.
down on the table. If they're comfortable, I'll let them rest for 15 minutes, give them a little button to press if they need me, and I'll walk out. If not, I can stay in the room and chat with them.
So the idea is, so I have my 10 needles. I'm going to go for the max here, or
Mhm.
whatever. I have, and I'm hoping I'm not itching, right, Jay? I hope I don't have the itch. I'm like,
No, no, no itching.
I'm the itch. I get the itches.
We'll leave like one arm free. If I know the person is a fidgety person, I can usually tell, and I'll leave like
Jay,
their arms completely free
Jay,
usually,
I'm
so
going to
they
be in
don't move
trouble,
around.
right? Jay knows I'm going to be in trouble right now. He
We'll
knows
do
that's
your legs.
why he's smiling right now. So, I even lost it. Okay, so we're sitting there and we've got all the things. We got all
Yeah.
the things. I do want to hear about the red light. I've heard things about that too. I want you to explain that. But the whole idea is to get into a state of relaxation
Mhm.
and what?
Yeah,
What?
and so these points are working on different things. So,
Mm.
lots of scientific evidence that different points on the body do different things. For example, we've all banged our knee, right? You've been walking
Mhm.
around, you've banged your knee on the desk, you're like, haha, this hurts, and it kind of shoots up your back, or you feel it in your stomach, you get that stomach ache, or maybe your ears start ringing. It's
Mhm.
kind of like that. So, there's points that are maybe not on your back that can help your back. So we'll use some points on the feet that actually end up helping your back pain. Or we'll use a point behind the ear that'll help you with your sleep routine. I do a lot of women here, so I treat a lot of hormone
Mhm.
imbalance, a lot
Oh
of
boy. Oh boy.
infertility, a lot of mothers that just had babies or are getting ready to have babies. We can help breech babies flip,
Oh,
lots of different things. So just
fascinating.
yeah, using those different trigger points and just really knowing what they do. There's
Can you
tons of points on
reduce wrinkles and fine lines?
there. I do facial acupuncture. I actually got to do some of that
Wait,
today. So
wait. What?
that's
Hold
like a whole cosmetic acupuncture is a whole thing.
on. What?
Yeah.
What?
Yeah.
What?
People
What
Now
are
don't
you?
you've got her hooked. You got her
What?
now.
What are you talking about? All right, Jay,
It's
you
a
cut me
thing.
off here. Like, I don't want it to be the personal Kathy experience here. So if you need to cut
No,
off,
you're good.
I need to hear about this face stuff.
Yeah.
I'm getting to be an old bat at this point, and I need to know. I need to know. I need to know.
Okay. So facial acupuncture
I'm gonna.
is
And you have an
almost, we
appointment
say
for me
it's like
tomorrow, right? Tomorrow, you got it.
Gotcha. The facial acupuncture, it works really well actually. It also works if you have any like wrinkles you want to work on, acne, any like rosacea on your skin, lots of different things. So
You get the 11 lines?
we can work on all of that. And there are people that specialize like just in facial acupuncture. I do it, but that's not like my
What am I just hearing
that's
about?
not my bread and butter, but you're welcome to come for it, and I surely know how to do it. So
Why am I just hearing about this? Okay. I am like, I don't know. I'm like, I need her number.
it's truly great for so many things, and it really a holistic medicine. Anything, like I said, anything from your diet, digestion problems, to sleep, to back pain, to just needing to really be regulated. Acupuncture is amazing at all of the things. It's
So
been
Kathy, I
studied
think
for
you
thousands of
got
years.
weirded
So.
out when
I'm
Linda.
done being weirded out. I'm done being like, she's gonna reverse time for me. I'm done being weirded out.
We also can do like facial cupping. We have like cups that are tiny, much tinier than this one, and
Jeez.
that'll help the wrinkles too. So,
Then I'm gonna look like I got socked in the alley, but I'm
no,
willing
it won't leave any bruises on your face. Don't
for the
worry.
sake of beauty. I'm willing to look like I've been knocked out. It's gonna happen. And then I'll come on the next week's podcast and you'll be like, what happened?
And maybe we can film while you're getting it done. Just
Oh,
really
that would be good. That
show
would be
the
fun.
viewers what
That would be entertaining.
Kathy, you heard Linda talk about
Yeah.
how they lit her needles on fire, and you were like, "That's what."
Yeah. But if it gets rid of wrinkles, I'm willing to be on fire. Okay, I'm willing to be on fire. Yeah. I'm all about it. Got it.
Kendra, I was going to ask if you kind of sort of answered the question I had. Like, are there different? You said there are different points on the body that address kind of certain things within us. Are there kind of different levels? Like, is there like this is going to sound silly? Like, is there like a beginner level of acupuncture, and then you kind of advance a different thing? Like, for example, the fire. I'm sure that's kind of a more advanced kind of level of. That's like a circus version of acupuncture.
So it just depends on what your symptoms are. Of course, if you want to treat fine lines and wrinkles, the treatment's going to be a little bit different than if you're having severe foot pain. Um, yeah, and as far as the fire, I'm not sure about needles on fire. I've never heard of that, but we do use fire for the cups. It looks scary, but it's not. We just use a little stick of fire and warm the cup up. Once the cup is warm, it creates a suction. So the fire looks really cool. People love I guess TikTok videos of lighting things on fire. But it's not as scary as it sounds. We're not lighting people on fire. No.
Jay, you want to come film when I'm getting set on fire and getting needles in my face? Do you want to come film?
I will be entertained by watching you, knowing that you're like part of you's freaking out, and part of you's like, yes, this is
as far as
all about
marketing,
filming
people
that.
love those videos. People love videos of you lighting stuff on fire. That's great marketing.
Right.
Very interesting for the people. But yeah, different ailments are gonna have different treatments. So just knowing what to expect.
You know what I always thought about too, and maybe this is stories that we make up in our head because we have lack of knowledge, right? I always wondered, or I worried, or I thought, maybe I didn't worry, can you get any kind of nerve damage if somebody puts acupuncture in a spot that's like, whoops? I that is something I've thought about.
Yeah. So
I've never asked anybody the question.
You totally can get very injured from acupuncture if the person's not trained.
So Jay just can't do that. I just can't have Jay.
Yeah, I wouldn't recommend.
Jay would not volunteer to do that to you.
Don't allow somebody that's untrained to do acupuncture. But in acupuncture school, we spend 2 years of acupuncture school before we're even allowed to touch a needle. So we're learning every safety protocol, every piece of anatomy, we know exactly what we're doing. And so we keep it nice and safe. But you could technically be injured.
Do you think that most people, do you know the person? I don't know. I know I'm not trying to put you on the spot with this question, although it's going to sound like it. Do you think people come more for somatic physical type things or more mental health type of things, or just kind of a 50-50 mix? Do you have kind of a sense of what you feel people use it?
I would say a good 50-50 mix.
Mm-hmm.
Yeah, definitely. I would say half of my patients come to me for some sort of mental health. Yeah, and the other half, I would say probably 25% of them come with some sort of pain, and the other 25% come with some sort of hormone imbalance. Like I said, I treat a lot of women, so that might not be all acupuncturists, and every acupuncturist kind of has their specialty. You know, some are
Okay.
really great with sports medicine, some are
Mm.
really great, some only treat mental health, and they're amazing with it. Some treat infertility and women's health. And so everyone kind of has their niche, I guess you could say, just like a Western doctor, you know, they're
Yeah.
pediatricians. I do treat children too. I don't use needles on them usually, but we do
Hmm.
some other nervous system work. We use cups. We'll use like a gua sha tool, which is kind of like a stone.
Yeah. I use that on my face.
Yeah, uh-huh. See, I do a lot of gua sha, and especially
That's
with
not how I
with
say it.
kids.
I said it. I'm not going to tell you how I said it, but now I know I'm
That's
saying it
okay.
wrong. Okay.
That's okay. We have our Chinese
Maybe I'll tell you
medicine
later
lingo.
how I really said that word.
And this is like the main medicine in many parts of the world. So, you know, here we're used to, you know, if you have a problem, you go to the
No.
podiatrist or you go to the pediatrician or the allergist or but you know, in other parts of the world, this is their main source of medicine. So we really have a well-rounded uh,
What about, let me ask you this. What about people who have like blood pressure? I'll just use blood pressure,
yeah.
cholesterol, that's kind of common things that people have. Is acupuncture something that's used
Absolutely.
in part of the
Absolutely
treatment
amazing. We have specific
plan?
points just for that. And like I said, some people specialize in those things even.
Mm-hmm.
So there's a lot of research available. You can find the research, figure out the best points, all of those things. And we have access to all of that. So
This is
really a great medicine. Yeah.
fascinating to me.
I know. And it
We,
works really well. The thing is, it works. So even when people, you know, they may come in and they didn't go to 5 years of acupuncture school, so they don't really understand what point is for what, but they're here for it and they get better. So people keep coming because they're getting better. Um,
well, I
you know,
think
otherwise they wouldn't return.
the thing Jay and I got into this this podcast business, trying to look for ways to people to be healthier, to be more well. But I just can't believe how broad our topics get. Like,
Yeah,
I mean, when we started a year ago, I would not have said, "Oh, we're going to talk about acupuncture." But it's just amazing to me how self care, taking care of yourself and your physical health, your mental health. I mean, they're just one.
yeah,
So.
they're so intertwined.
And Jay and I are always thinking of ways not only for people to just mentally feel better or just to get out and do something to take care of themselves, but like walking or massage or connection with other people, all those kind of traditional things you think of. But this acupuncture thing is really fascinating to me because that it could literally be part of somebody's treatment plan to make them physically more healthy.
Definitely, yeah. Physical pain and any physical ailment is really going to have an effect on people's mental health. You know, if
Yeah.
you've had that back pain to where, you know, you're not able to play with your grandchildren anymore or your children, you know, it's really preventing you from doing the things that you love doing, that's going to have a big effect on your mental health. So it's very important to take care of your physical health. And a lot of times, you know, people have seen 20 different doctors and they've tried 20 different medications and, you know, nothing's really wrong. They don't know what's going on. Maybe, you know, they just know that they have pain and it's not a great day. So just being able to really help them to feel
I can
better.
tell you another story that I may or may not have made up in my mind about acupuncture. Is it in my mind there? It's like moving fluid in your body. Like
Mhm.
it's is. Did I make that up?
No, it does do that. Like it does work to move the blood, move the fluids, release the muscles, work with
Mm,
the nervous system. That's pretty accurate. You know, not as scary as it sounds. You know, we're not like doing huge manipulations, but just those small. You know, sometimes if you think about it, and you're stressed and you're really tense and you're holding your whole body tight, the blood really builds up in your muscles, and you might feel sore after, as you know, like somebody who had a panic attack or something, they might have physical pain afterwards. So really like working to move the blood and move all the fluids in the body and just kind of reset. Acupuncture is a great reset.
It's funny, Kathy, how you said this self care thing's so broad. It's so broad, but yet it seems so connected in a lot of ways.
Yeah.
They're just different ways to get to the same goal,
Yeah.
if that makes sense.
Lots of different modalities that you
And
can
I think I was probably the same as Kendra, like acupuncture. That's some bougie treatment for somebody that just, you know,
Yeah.
but there's
That
got to be
was
something else
totally me.
before you do that, you know? But I guess really that's a something we're putting on it that's not fair to
Yeah.
put on acupuncture. It's not just some bougie thing for some
We,
brave soul.
we had
And
a guest come on.
yeah, knowing that this is used, you know, insurance covers it. So
Oh, it
that's why
does?
a lot of people have insurance plans that cover it. It's also used like in a lot of treatment centers, especially addiction treatment centers. They
Okay.
have auricular acupuncture, which is acupuncture of the ear. So there's some points in the ear that'll really help with addiction. And they'll have those people come in and the treatments
Wow.
really work very well. So just knowing that it works, for me, it doesn't so much matter as, you know, the explanations and how it works. And sometimes I'm like, I don't know why the point on the elbow makes the back feel better. Like I just know that it does. It works. And if it works, I think that's what really matters. You know, people are getting better.
Wow, that's pretty encouraging about addiction treatment, right? I didn't even know that. Wow, that just seems, I mean, maybe I'm making it too simplistic. Like that seems so simple. Like why wouldn't that be an easy grab to take if you're somebody that's really struggling
Yeah.
with
And
kicking?
a lot of treatment centers, inpatient centers, they will actually have somebody that comes in once or twice a week and does the auricular acupuncture.
Wow.
Yeah.
She's blowing my mind here.
That's a big thing too.
So,
I
Kendra,
love
you talked a little bit about cupping. You do cupping as well. Now, I'm a little bit familiar with cupping through sports medicine, athletes, getting it to recover and
Yeah,
improve
Michael
circulation.
Phelps, right?
Yep. He
Everybody
walks
knows
around.
Michael
He walks
Phelps
around
always
with the
has the
circles all over
spots
his
on his
body. Yeah.
he's always got the bruises on his back. So
Yeah.
yeah, we'll often use that in combination with acupuncture. If you have some sort of pain, whether it's like a chronic pain or you just got an injury, we'll use like the cups. Like I said, these are the ones that we use with fire. And then I also have ones that are just like a suction cup.
I've seen that.
Yeah, so we have two different kinds, and we'll use those to just really release the muscles. It does leave a nice bruise, so you'll have like a tattoo for the week.
But not on your face, is what you're saying.
On the face, we do it very gently, so it doesn't leave a bruise because nobody wants to walk around with bruises on their face.
You know,
That's how they hide the wrinkles. You got bruises instead of wrinkles, so that's why the wrinkles go away.
these
That
dark
would just be
circles are
embarrassing.
cupping. They're not really there. This is cupping.
So,
That's
Kendra,
actually how I recruit patients. You know, I leave bruises, and then people are like, "What happened to you?" And they're like, "Oh, Kendra."
Kendra.
Exactly.
Is it a circulation thing with cupping? Is that kind of it kind of stimulates circulation to kind of flush the area?
Sure,
It pulls the blood
circulation,
too, right? It
pulling,
pulls.
yep, pulling on the muscles, just really releasing tense muscles. Yeah, it also can pull out toxins if you have any like toxins in the body, just a good detox. So yeah, the cupping is really great too. I use that a lot. Probably with most of my pain patients, we do a lot of cupping. And sometimes just people that need to relax. It's almost like a massage. So
I'm assuming cupping is more targeted on the area that you have the pain. Like if I said I had, so correct me if I'm wrong. If I have lower back pain, would cupping go to that lower back area? But if I was using acupuncture, it might be in my foot, right?
Mm-hmm. not the bottom of your foot. I won't do that to you. But yes, so the acupuncture can sometimes, we call it like a distal point. So a point that's kind of far away from where your actual problem is. So we have lots of those all over the body. We do also sometimes needle the actual area. You know, if you're having low back pain, we might want to go in and use needles and loosen up those muscles. But yes, the cupping we usually do on the area, the problem area. So,
Kendra, frequency of folks coming in? Is it kind of dependent
Mhm.
on their specific condition,
Yeah,
as
depending
far as
on
how
what
frequent they
happened.
can come in?
An injury that maybe just happened, we might have you come in more frequently, maybe twice a week for three,
Mhm.
4 weeks, and you're fine, you're good to go, you'll be feeling better. Other people who have had back pain for 20 years, maybe it'll be like an every week thing. We'll have you come in once a week until you start really feeling better. After 6 weeks or so, then maybe we'll move to twice a week and then just once a month for just maintenance, we'll call it. So, like, it just really depends on what you're coming in for. For addiction treatments, we'll do it pretty aggressively. So, maybe have you come in 4 days a week for 2 weeks to really detox and help you with those like constant addiction thoughts, that sort of thing. Just depends on what you're dealing with, but we'll usually come up with a treatment plan that works for both of us and gets you the best results, because we
So
really want people to feel better.
what about the affordability?
Okay,
So
so insurance is a great option, and lots of different practitioners take different insurances. So finding somebody that takes your insurance, if you have
Mhm.
insurance, is important. Besides that, usually, you're paying by the session if you don't have insurance. Yeah, ranges depending on what kind of treatment you need, how long the treatment is. I'd say like
I wonder if someone's insurance doesn't cover it, then I wonder if like their flex cards, the
yeah, we
HSAs or
take HSAs. We also can make a super bill for you if your
Mhm.
particular insurance isn't. I'm not in network. You can bill out to your insurance on your own with the super bill. We try to do everything to make sure it's accessible. Um, I offer like mini sessions. So once a month, I'll do like a 20-minute session for $35 just to give people access to
Oh
acupuncture.
yeah.
Somebody that's new and wants to try it out.
Mhm.
Maybe they're a little scared. They don't want to commit to a full treatment regime, but they just want to test it out. So we try to make
Very,
it really accessible to people.
I think this is amazing. I really do. I like it. I like this.
You're almost sold, minus
No,
the needle, right?
no,
I won't show you the needle anymore.
you got me. You got me at face wrinkles. No, I'm coming. I'm coming like tonight. It's happening
Great,
tonight.
I'll be here.
Mhm.
So Kendra, tell us a really cool kind of, obviously without giving any patient specifics, but like a really cool success story, maybe something that
Mhm.
just kind of would draw somebody to come try acupuncture. Maybe there's a specific case that really kind of stands out to you that kind of is a marketing tool for getting people to do acupuncture.
Yeah. Well, I guess it depends on what you're looking for. Like I said, I do a lot of mothers and women, a lot of women that want to get pregnant and have babies, and they've been dealing with infertility for long periods of time.
Wow.
That's like one of my specialties. So I've had tons of patients where they've come in for just a few months and then they're like, I'm pregnant and I've been trying for 3 years and nothing. And now I tried
Mhm.
acupuncture. So that's always like, it's the most beautiful thing for me. I feel like that's
Yeah.
always very special. But just having people that are able to, play with their grandchildren again or walk the dog without having severe pain, just the little things are always, it
Does it
always
help people
feels
with
so good.
arthritis? How about people that have
Yeah,
that?
arthritis, any sort of pain. It really targets like those nerves that are
Mhm.
relaying the
I
painful
guess
stimulus.
inflammation too, right? It
Yeah,
like
lots of
alleviate
inflammation.
helps with the inflammation. Yeah.
Acupuncture can help with so many things, and I think that's what people don't understand. A lot of people that just like
Yeah,
you probably heard of acupuncture, you're like, oh, it's for knee pain, or everyone kind of has something in their head of what they think it's
we
for.
do. I came in here with stuff that was not accurate.
Yeah.
Debunking the myths.
And I noticed, especially here on the Eastern Shore,
We're not
well,
trustworthy.
I think
Trusting.
over the bridge, the closer you get to the bigger cities, it's a little bit more popular, a little bit more
Yeah,
talked
we're like,
about.
what are you doing? What are you trying to do to us?
Over here,
Yeah,
it's been a lot of educating people and just teaching people
sure.
what it is. And like I said, offering those mini sessions to kind of just get people to try it out, Even if you come in and you decide it's not for you, you didn't lose much.
Yeah.
That's true.
So
Do you are there things that you think match well with acupuncture? Like if somebody's doing that, make sure you're your water intake is different, or is there, is there anything that you suggest to go along with it, I guess, or is
Yeah,
it just
so
individual?
we'll make suggestions each time. We
Mm.
make suggestions on anything from, I might tell someone, hey, you need an earlier bedtime. 2 a.m. to 7 a.m. isn't working for you. And so I'll usually make lots of suggestions, gentle suggestions, suggestions on things that people can incorporate into their diets, or herbal medicines that they can
Mm.
try, supplements. We'll give them instructions for post acupuncture, showers, what you need to expect, if you should expect to feel any pain afterwards, any bruising from the cupping. We really go over all of that. And that's the special thing about acupuncture. We get a lot of time to chat. So,
What about red light? You were talking about the red light. I
yeah,
feel like that's getting a little more trendy on social media. You'll
it
see
is.
masks, or the red masks, or the eye masks, or whatever.
Yeah. Well, red light therapy, like the infrared lights, it's great for any sort of pain, inflammation, and then also somebody that has like seasonal depression, or they're not getting enough sunlight, the red light is really helpful for all those things, and I use that in almost all of my treatments. Unless someone tells me they're a really hot person and they don't like heat, they're getting
Mhm.
red light. So
Well, now what if somebody's buying some of those? I have not. What if somebody's buying some of those products off of the internet?
yeah,
Is
just making sure that they're actually red light, first of all, not just a red tinted light bulb. Making sure they're infrared, high quality. All
Mhm.
of that's really important in safety.
True.
Using it on your face without covering your eyes properly is probably quite dangerous.
Like the old tan in bed thing.
Exactly. Yeah. So, using
Look
it
at
using it sparingly. Like I said, we
Mhm.
have a lot of training. Um, don't really recommend people overusing it in their own home. It's kind of like cupping. People like to do cupping on themselves, which isn't always best practice. Yeah. It's just important that you know all the safety tips and know the actual anatomy of the body and how it works. So having somebody that's trained is important.
So is your family all coming to you, hey, this hurts, this hurts, this hurts? Or
Yeah.
is
My
it like,
family, my neighbors, people at the mall, they're like, what do you do? I'm an acupuncturist. And they're like, 12 years ago, I had surgery. And I'm like, all righty. you know, my neighbors, I pretty much know everybody's issues. So
that's hilarious. That really
it's
is.
sweet though.
So you're really doing therapy besides acupuncture therapy.
Yeah, probably
You're,
50% of what I do is just
Yeah,
talking to people,
getting to the
hearing
root
them
of
out.
getting to the root of what needs to
Yeah,
be addressed. Yeah,
yeah. And people want to be heard. A lot of times you go to the doctor's office, they're like, what's going on? 3 seconds later, the doctor's nowhere to be seen for the rest of the appointment.
good point, right? Good
So
point.
just having someone that really listens to you and hears you out and understands what's going on and all the small details, because the small details are important.
Because
Knowing
typical
what
medicine
somebody,
is so quick, right?
yeah,
In out, like you said, here's a medication
yeah,
perhaps, and then
knowing
follow
someone's
these instructions.
diet and their sleep patterns and their
Mhm.
habits and all, it's so important, and it plays such a big role in the big picture of, what's going on with that person and what they're dealing with.
Wow.
so
Wow.
So, Kendra, before we switch gears, tell everybody how they can reach you, your hours, and where they can find you. So the folks that are listening can actually come see you.
Yeah, so you can find the village at thevillagemd.com. We also have a social media presence, the Village Holistic Maternal Wellness Center. I work with radical relaxation, so you can find me. I have a good Instagram, Facebook presence. You can find me there. I've got videos of acupuncture needles and cupping, and you can watch all that cool stuff there. So, yeah, that's radical relaxation.
And what are your typical office hours?
I'm here most days, Monday through Saturday. I try to offer a little bit of everything. I've got some evening hours for people that have work, mornings, a little bit of weekends. So I got a little bit of everything.
Gotcha.
Nice.
Try to really make sure that it's, like I said, accessible to all people.
Hmm.
Very cool. So before we get out of here, we're going to do our usual and end our episode with a little bit of fun talking movies, TV, and streaming. So, Kendra, anything you've been watching lately that you've really enjoyed?
Oh, I've got nothing, but I do. So I'm taking my kids to Disney World soon, right? And they don't know this yet, but we're staying at a Peter Pan themed Airbnb. And so
Oh
I'm
my
trying to get them like
gosh.
into the Peter Pan movie. So I just got a copy of that. I'm gonna
Gotcha.
make them watch that over the over the next couple
Oh,
of days so they
that's
can be excited for their vacation.
Awesome.
that is awesome.
So Friday, Kathy, I went and saw Companion, the movie Companion, and I was actually I misunderstood what it was about. I had not seen any reviews or anything or any
I can't
trailers.
remember who was in that.
It's Dennis Quaid's son. I can't think of his first name. He's the lead character, and it's nobody else that's like a major movie star. I was actually pleasantly surprised. It's a kind of a total. It's kind of AI. It's a. I thought it was a horror movie, and I'm not a big horror movie fan, but it's actually a thriller, like a
Hmm.
psychological thriller. Um, and it this guy Dennis Quaid's son has bought or actually rented this AI robot, but we don't know that at first. It's she's so lifelike and she's programmed to in all these ways that he wants to program her, and kind of things go haywire. And normally, with a I've seen kind of similar movies. Normally, the quote unquote robot is the bad guy. He ends up turning against the humans or whatever. This is completely flip it on its head. You're actually rooting for the AI robot. Um, she's like the victim in all this, and the human is the bad guy. He's the villain. Um, he's trying to rob this other guy and wants to use the robot to murder this guy to steal his money, so that he doesn't get caught and blame it on the robot. And then the robot kind of goes outside his programming and figures it out, and kind of there's some surprises along the way. I was actually entertained. I liked it better than Flight Risk, um, so that was cool.
I haven't found anything that's making me want to go to the theater lately.
Now, Did you happen to catch any of that show after The Voice last night?
Very little, very little.
Okay,
But I like that actress.
yeah, but you're right.
I
She was in Manifest. Yes,
Yeah, and she was playing a law enforcement in that, and I liked her in that role.
she's a profiler. She's an FBI profiler in this one, and it's really good. So Kendra, Kathy, and I are big music and TV and movies fans, and so last night The Voice came on, and we were watching The Voice. What did you think? I talked about it earlier. So you liked it.
Yeah, so I always have been an American Idol girl over The Voice, and then Jay has brought me over to the other side to also equally like The Voice. So, but he has to remind me like weekly. It's on.
I
It's
feel
on.
like
It's on.
it's like you're cheating on American Idol.
I know
That's why I can't watch it.
I kind of felt the same way, but I'm getting past it. And then there is a point in time where I always fall off. I fall off, and then Jay just has to tell me what happens at the rest of it. But I love my favorite part. This is probably the weirdest thing to say, is not the talent. It's watching the judges interact. I don't on The Voice. I like I'm in it to win it on American Idol. I'm like I got somebody and I'm watching them through. But
Yeah, you got to watch it till the end, right?
yeah, but I'm not picking a star or I'm not on The Voice. I'm just watching the interaction between the judges, which is
Oh,
fascinating.
that's so interesting.
I don't know why I do that, but like I love Michael Bublé. I mean, these singers are so brilliant to go on these singing shows because then I'm sure people are like, oh my gosh, what do they sing and whatever. And I always liked Adam Levine, before, so I was glad to see him come back and act like he did before. I was like, how's he going to be without Blake? But it was fine, and seeing the bantering back and forth. I love how they all banter back and forth.
It's funny, Kathy. To me, it's a brilliant marketing tool because we get to see a side of these
Yeah.
singers that we don't normally get because they're so. At least it appears this way. It's hard to tell sometimes, but they just appear so normal and real, and
Like they're your friends, like them.
and who knew that Michael Bublé and Snoop Dogg were actually legitimately really good friends? Like,
Are they?
yes. And Snoop Dogg was on
I
last season.
it.
He was I always liked Snoop Dogg. I love me some Snoop Dogg now. Like
I know, right?
He's a
he was so
character.
vulnerable and so real and so invested in these young people being better just as people and being a mentor in general. He loved doing it. It was probably my favorite season of The Voice, more from that aspect than it was the singers. And the singers are always great.
See that? You're into the judges too.
But there's always, like last night when Kelsey got up and sang her song with that girl.
Yeah.
There's always those, and all four will do that. Somebody will come on and sing one of the judges' songs, and then the judge will go up and sing it with them. And then it's just this cool, really cool moment to watch someone who idolized this singer get to sing with their idol in a duet of that person's song. Yeah.
But I like how they're ragging on each other and just messing with each other. It's
Well,
just
see,
fun.
now John Legend and Adam are the new Blake and Adam.
It is, right?
They've taken their place. And Bublé's, he's funny. He's just so self-deprecating and just he's like,
I want to be his friend.
he doesn't take himself too seriously, but you can tell he's really like into like mentoring these people. And Kelsey's just fit right in. This is the first season. She's fit right in. And
I didn't know John Legend was a judge. He's on there.
Yeah.
They kind of rotate
I'm
judges.
a big fan of him, so much so that I named my dog Legend.
Really?
So maybe I'll have to start watching just for
But
him.
didn't he say it was his 10th
This is his
time?
10th season. They normally come on for 1 or 2 seasons at a time, except for
but when they say season, I mean there's like 2. It comes on 2 times a year, so it's like they are like half seasons.
This is season 28 of The Voice.
But it's only been on, but it hasn't been on 28 years.
No, it's not. It's not as old as Idol.
Now Idol will come on soon too, right?
Yes.
And then that's where I'm going to get in trouble because
I do still love me some Idol. Don't get me wrong. I want to see how Carrie Underwood does as taking over Katy Perry's spot this year.
I like Lionel Richie and Luke.
Yeah.
But these artists are so smart. You're right. They're marketing themselves, and then you're like, yeah, I want to go see them in concert.
I think the only thing, and Cathy, you and I have talked about this with The Voice. A lot of times, I think the public votes because of the judge, as much as they do the singers. And they're all very talented people singing, but Blake won so many times because Blake's just so popular. So sometimes his singer was the best, and sometimes it just wasn't. But he was so popular. I think Reba got a lot of votes that way. So that's my only kind of complaint about The Voice is it kind of lean like when not horror was on 2 seasons and won both seasons. I mean, he's a One Direction guy, so all the young women are going to vote for Niall's artists, no matter who they are.
Yeah. Who was he a judge with?
He was on The Voice.
I know, but who else was with him?
Oh gosh, he was on the first year Reba was on. He was on.
Okay.
Gwen was on 1 year. I can't remember. He was on back to back. That's typically what they do. They'll sign up like a 2-year contract.
Okay.
Except for the OGs that like
Jay's like all knowing. Jay's all knowing.
Adam and Blake were like the first dozen seasons straight, and the other 2 spots. Now all 4 spots seem to kind of rotate.
Yeah.
So have you been watching since the beginning?
Yes.
Okay.
He is
a true fan.
Yeah, I remember the very first person that won, and I remember like, there's been
He's got such useless knowledge. Like you watch the Grammys, like, oh, that guy got rejected from whatever season, whatever, and I'm
Benson Boone. He wasn't even good enough for The Voice or for the American Idol, and he had the biggest downloaded song of 2024.
You know what I'm saying?
that is important to know.
See what I'm saying?
I want to know who the people are. They're not like producers and all, not music producers, but show producers on the Idol that listen to these people and decide, okay, you could come on and try out. Who like turns down Benson Boone?
Yeah, but it might be like any job in the world, and they could say, well, you come do it then if you think you can do it so good. That's what the Idol judge is going to say to you, Jay. You come do it.
I think in their case, they're probably looking at it as much as how's this person going to appear on TV as much as it is their singing voice.
Yeah, I think it's much of like even American Idol, much more of like an entertainment. Like,
well, plus you want them to have
most entertainment.
Don't you? Yeah, right. Although I feel like it's less of those kind of people that aren't going to make it as
That's
much as
true.
but I think they like a good story, a good
Yeah.
backstory.
I do like on The Voice how when they first try out, the judges have their backs turned and they don't see them the very first time. So it's just about the voice. And with Otto, obviously they go in and they're 10 feet from them when they're singing right to them. But the only thing about Idol is I think they go too heavy in the stories. Don't get me wrong, I love a good story. Like when Loretta Lynn's granddaughter was on and they talked about her. I get that to a point, but I think they go too heavy. So then people are voting because of the story and less because of the
Yeah, they're
music.
playing on people's emotions.
Although Ian Tongi had a great story and he was the best singer both. So that was kind of like the best of both worlds.
He's got it. I'm telling you.
That's funny.
Yeah.
So we want to thank Kendra for hopping on and educating us about acupuncture. And now she's got Cathy talked into doing some facial stuff.
When I come in looking good, you're all I'll be like, this is from Dr. K.
We'll do a transformation. So this is the before.
Listen, I'll even get a little K tattooed on my cheek.
KJ.
Oh gosh.
Art by KJ.
Kendra, your email says Kendra DJ. So I'm thinking, does she do music while she's doing?
Okay, I made my email address when I was like 12 years old. So give me a break. I will also say my middle name starts with a D.
There you go.
Well, I knew what it was, but it was just kind of cool, like Kendra DJ.
It wasn't until I got older that I realized that, like, when I was telling people my email address, like, it now sounds like I'm a DJ. But then it was like, now I can't change it now. Like, I've been using the same email for 20 years. So.
You got like the dial-up AOL.
Exactly. I was an original Gmail, an OG email account. So.
OG mail.
Exactly.
Yeah, before it was cool.
Exactly.
Well, Kendra, thanks so much for joining us.
Yes.
We would love to have you back on again sometime and talk some more about maybe and we'll do a Cathy story. We'll do a follow the process with Cathy and her acupuncture journey. We'll start with her anxiety attack sitting in the car in the parking lot, and then all the way to I look good.
Not only is she not having anxiety anymore, but she's wrinkle free.
Yeah.
Oh, I love that.
So Kendra, hang tight. We're gonna when we hit stop, hang tight for a few minutes, and we'll kind of go from there. Thanks, guys, for listening, and catch us next time on Easter Shore Talk. Thanks, guys.
Thanks.